Documentation protocols. Post-rape care form, commonly known as a PRC form, is a medical data collection tool filled by the healthcare provider when attending to the survivor. The form allows a space for documenting results from the history taking and examination. It facilitates the filling of the P3 form by ensuring all the relevant details are available and taken at the first contact of the survivor with the health facility. The PRC form strengthens the development of a chain of custody of evidence by having a copy that can be used for legal purposes, showing what specimen was collected, where it was sent, and who signed for it. A doctor, a clinical officer, or a nurse can fill the PRC form.
For all cases of post-rape, for rape and gender violence, we usually have a record, and the record is usually done in 2 booklets. The first booklet is the post-rape care booklet, which have got forms which are in triplicates, self-carbonated. So this is the post-rape care booklet, and as you can see, it has got 3 copies of the same serial number in each page.
The form is a triplicate and must be filled and signed completely by the healthcare provider who attends to the survivor of sexual violence. The original form is given to the police for custody. The duplicate is given to the survivor and the triplicate remains at the hospital.
So now this form has got 3 copies. So the 3 copies, we have 1 copy for the patient or the guardian of the patient. Tuko na copy ingine ambayo inaenda kwa polisi. Alafu tunaachwa na copy moja. Sawa sawa. So ile original is a white form, which is the original form filled for all patients who are undergoing post-rape care. So hii tunapatia police officer, hiyo ni yake ataweka kwa ile faili ya huyo mgonjwa. Then we have the blue one ambayo ndio fomu ya mgonjwa, ama kama ni mdogo ni fomu ya mama yake ama ule mtu anamshughulikia nyumbani. Kwa hivyo hii ni fomu yako, uweke vizuri. Alafu sasa kwa kopi yetu tutaachwa na hii. Iko na carbon, kwa hivyo ile details iko hapa ndio imeenda hapo na ndio tuko nayo kwa hii. Sawa sawa. Okay.
Na tukitaka kurudi tena.
Mkitaka kurudi mtakuja tu na hiyo. Hiyo inaonyesha ile dawa umepewa na ile kitu yote ambayo ilikuwa imefanyika. Venye umehudumiwa yote imewekwa pale. Kuna kitabu ya gender violence, sababu hii mambo ya rape inakuwa yani mambo ya gender violence. Kwa hivyo kila kitu ambayo inafanyika tutaweka hizo records kwa hii kitabu.
The Kenya Police Medical Examination, commonly known as the P3 form. This is a police form that is issued at the police station. P3 form is for all assaults and therefore not specific to sexual violence. It is therefore not as detailed as the PRC form. The P3 form is filled and returned to the police for custody. Let the survivor know that the filling of the P3 form is free of charge for any case of sexual violence. The P3 form is a link between the health and the judiciary systems. The medical officer who fills the P3 form or their representative will be expected to appear in court as an expert witness and produce the document in court as an exhibit. Ensure all the details of history, examination, and findings are accurately documented in the PRC form and SGBV register.
0727.
SGBV monthly summary data should be compiled by the healthcare workers and sent to the Health Records Officer to upload in the DHIS.
So after we have filled the PRC form, we have taken history from the patient, we have done a medical examination, we have filled the gender violence form, then it comes to the part of filling the medical examination reports on the P3 form. And the P3 form has got various parts, and the first part is usually filled at the police station from which the case is reported and the form is collected from. So the police officer or the officer who is commanding that station should indicate the station from which is sending this form, the OB reference number, the hospital to which is sending this form, the name of the survivor, the age, the date and time of the alleged offense, as well as the address of the survivor, the date on which it is sent, and on whose escort the victim comes. So it can be a police officer, it can be a relative, or sometimes it can be self. The date and time on which this was reported, and brief details of the alleged offense. And then it has to be stamped and signed by the sending officer. Then once those ones have been filled, then the medical legal officer in the hospital has his part to do. And the first thing is to fill his board registration number, so that because he has to be somebody who is registered as a medical practitioner in the country.
When a sexual violence case is before a court of law, justice can only be achieved if evidence produced by an expert witness is clear, properly documented, and well preserved. Documentation and reporting of sexual violence is the key to corroborating the survivor's evidence in a court of law. Thorough documentation will enable the court to determine when, where, and who is responsible for the violation. More importantly, to secure justice for survivors, you must collect and preserve concrete evidence as you prioritize a comprehensive care to restore dignity and respect and save life. Consent form. The survivor has to sign a consent form as evidence that they have agreed to medical examination and release of the findings of the examination to the police.
After sealing the specimen, we are going to write the names, the particulars on the envelope, and then it is taken to the laboratory for examination. Include the sample type, the name of the survivor, then it is given to a police officer who fills this part, then the date of collection, which is 30th of January 2015, facility name, the examining officer, the signature of the examining officer, and the designation. Again, you repeat the date. Then you give it to a police officer who fills the name, the designation, the signature, and the identity number.
Evidence linking the suspect with a sexual offense is mainly the work of the police, but the health practitioner must accurately document and report this information in the key documentation tools, that is the post-rape care form, commonly known as the PRC form, and the Kenya Police Medical Examination form, commonly known as the P3 form. Note that consent must be given prior to this documentation.